Okay, so Joel and Crystal have asked me to speak tonight on lab values. And so I prepared a little presentation here. Frequency of physical exams, each of us should, with these guidelines of these ages, this is how frequently you should have a physical exam. I don't even remember the last one I had, so I don't pretend to be a great example of getting exams done. But after the age of 40, every 1 to 3 years, and after age 65, every year. So that's the recommended. But there are ways to get lab values tested, your blood levels tested without going to a doctor. And Joel clued me in on this one, and I was like, wow, this is amazing. So you can go to simplehealers.com. There's a blood test link, and you can follow the instructions there. They have several different types of blood tests that are offered. These are some that you can get. I mean, you can get these through a doctor's office, or you can get these on your own independently. These are some that are offered through the link there. So kidney, liver, blood glucose. I won't be speaking about hormone levels tonight or adrenal function, but some of the others I will be touching on. So the question then is, what does it all mean, right? When you look at these numbers, all those acronyms, what are you reading, and how do you interpret those results? So let's first take a look at blood sugar levels. Now, there is some anatomy associated with this and physiology. So when we talk about blood sugars, just to kind of break it down a little bit and help you understand the physiology of it, the beta cells in the pancreas are what produce insulin. And then the insulin takes sugar that's in the blood into the cells, and then it's used there for energy, whatever energy levels we might need for our body at that time. If we eat too much sugar, then the beta cells have to work super hard. And if they work too hard for too long, they can actually stop releasing insulin. And then there's no insulin to move the sugar from the blood into the cell. So you have these high levels of sugar in your blood, but you're not getting it into your cells to be converted to energy. And so your energy levels remain low. And so if this is a continued pattern, you end up with very high blood sugar levels, and it can result in what's called diabetic ketoacidosis. And then ultimately, you will probably end up in the ICU with a new diagnosis of diabetes, and it can be fatal if it's not treated. So this is just kind of the overall picture of the process that leads up to diabetes and how important it is for us to manage our blood sugar levels. So just in case you're wondering, diabetic ketoacidosis, there are some symptoms associated with that. Excessive thirst, frequent urination, nausea, vomiting. And this fruity scented breath is one that's very typical for diabetics or when blood sugars are high. So here are the lab values for blood glucose, and they will often have you come fasting. So you've gone fasting for about 12 hours, and then you go in and you draw your lab, or you have it drawn at home. Typically, a normal fasting blood sugar level should be below 100 milligrams per deciliter. If it's greater than 125, then that's kind of an indicator that you might potentially have diabetes. For diabetics, if they do a fasting blood sugar level in the mornings, that target range should be 70 to 130. And then diabetic ketoacidosis is generally regarded as greater than 300 milligrams per deciliter. So it's very difficult to get those levels down unless treated properly. The hemoglobin A1C is a lab test that is done that can actually give you an indication of where your blood sugar levels have been over the last 3 months. So you can't cheat on this. You can't say, oh, I ate really good these last few days before my blood draw, and they'll never know. But nope, they can. They can actually test for that. So below 5.7 is considered a normal range. 5.7 to 6.4 is considered pre-diabetes, and then 6.5% or higher is actually considered a diabetic range. So you'll want to be cautious of looking at these numbers. Where do I fall in that range? If you are in the pre-diabetes range, you can reverse that, and with some nutrition and things that can help bring those levels back into normal. So you want to catch that as early as possible, so that you can bring those back into a normal range. So the moral of the story here is we do want to try to intake we want to decrease our refined sugar intake. We want to maintain a healthy diet, and even eating proteins with our meals will help to slow the digestion of carbohydrates and reduce the spiking of blood sugars after a meal. Also managing stress that leads to overeating and unhealthy habits. And there's another tool that we have at our disposal, and that is the MetaPower Assist capsules. And this is an amazing product that I wish I remembered to take more frequently than I do, because I know it would help me more than it already has. So what this does is this helps to stabilize post-meal blood sugar levels. You take this before a meal, maybe 20 to 30 minutes before a meal, just one capsule, and this can help reduce the uptake of carbohydrates and sugars. It kind of blocks it. It can also help with healthy fat metabolism so that you're not storing a lot of fat stores from that meal. So you can use it prior to your largest meal of the day or with a meal that contains your highest carbohydrate count of that meal. So this is a tremendous tool that was introduced quite recently to our doTERRA line. All right, next we want to talk about kidney health. And here you see the picture of where the kidneys are. They're situated pretty high in the abdomen there. The role of the kidneys, let's just review that first, because I always like to have you understand the physiology behind everything so that you better understand what's happening with your blood levels and in your body. So the kidneys actually filter the blood, and it removes excess waste and extra fluid. It's converted, to urine, and we waste that. And by managing those fluids, it helps to control the blood pressure. It releases a hormone called angiotensin. It can cause vessels to constrict. It can trigger how much water and salt it uptakes or excretes. And all of those help to manage the blood pressure in the body. So pretty important role of the kidneys. Also, it stimulates the production of red blood cells. The hormone that it makes, erythropoietin, tells the bone marrow to make red blood cells. And I don't know if you know or not, but the red blood cells contain the hemoglobin, which binds with the oxygen, and it carries the oxygen and takes energy to the cells. So the number of red blood cells you have is very important to your health and wellness. Some more roles of the kidney include it controls pH levels, and this maintains a healthy balance of chemicals that help to buffer the acidic level of the body. And then it keeps bones healthy. It actually produces a form of vitamin D that the body can use, which helps the body absorb calcium and phosphorus. So it helps to maintain healthy levels of all of those vitamins and minerals in the body and in the bones, so that minerals aren't leached out and then creating osteoporosis. So that's a very important function as well. There are three main kidney function tests that we look at our hospital where I work, and those are creatinine, BUN, which is also known as blood urea nitrogen, and then GFR, which is the glomerular filtration rate. Okay, let's take a look at each one of these. So if we look at creatinine, this is probably the most important indicator of kidney function in the body. Creatinine is a waste product that's used when our muscle cells go through metabolism and excrete wastes. And there are different levels that are normal for men versus women, and you can see those listed there. If you exceed those levels for your gender, for male or female, then it can indicate an early sign of decreased kidney function, which is something that you'll want to monitor, and you'll want to follow up with a physician if you're doing these independently and you see that those levels are elevated, causing maybe some concern. Maybe see a physician, see what can we do to, decrease the load on my kidney function, on my kidneys. There are several things that can cause stress to the kidneys, and we can take a look at that. The BUN, all of our cells use protein, and urea nitrogen is a waste product that's excreted from protein metabolism. And that urea nitrogen returns to the bloodstream. Our kidneys end up filtering the blood. They filter out the urea nitrogen that's excreted in our urine. But if our kidneys aren't filtering properly, that urea nitrogen will stay in the blood. And so we'll have an elevated BUN level. Now, this can be caused not just by damage to kidneys or stressed kidneys, but also by dehydration, by heart failure, and even antibiotics can stress the kidneys. I was working just the other day and we were giving an antibiotic to a young child, and we were carefully monitoring those levels in the blood to make sure that that would not be an issue for him and for his kidneys, that we wouldn't cause any kidney damage that might be permanent for the rest of his life. So that is something that's carefully watched with regard, especially to some nephrotoxic antibiotics. But you can see the normal lab levels here. Normal is 7 to 20 milligrams per deciliter. And when that level becomes greater than 20, that can be an indication of stress to the kidneys or decreased kidney function. So that's another, BUN is another one to be looking at.
Stacey, can I hop in there really quick?
Yes.
Are we going to see elevated levels when people are dealing with diabetes? Is that a common one where we're going to see kidney dysfunction and yeah, elevated BUN, or is that more going to be a GFR?
I honestly, I don't really know, but I think that all of them could be affected, because when you have extra sugar in the blood, that is affecting all of your organs, all of your vessels, and all of those little vessels inside the kidney are super fragile, right? They're very, very small, and they're filtering all of these things. And if they're getting jabbed like with a shard of sugar, do you know what I'm saying? Then those can be damaged. And so I would think that that would affect all of these, that diabetes could be affecting your kidney function as well. But I don't know. What have you heard, Joel? What do you know on that?
No, that's I I was under the same uh, thought process that you were, and so that's why I was just curious if you had any more insight that, hey, this one's a little bit more sensitive than this one. But yeah, I was under the same thought
Oh,
process. Yep.
no, I didn't brush up on that. I'm
No,
sorry.
no, you're fine. I was just curious. Try
Yeah.
to put you on the
I can
spot.
find out and post it later, if anybody's interested in that, or we can Google it, or find out in other ways. But yes, so the GFR is how much blood the kidneys can filter per minute. And so there's a normal range of 60 to 90 milliliters per minute. If it's less than 60, it could be some damage to the kidney. And if it's less than 15, it can be kidney failure. So definitely those decreased levels are ones that you'll be wanting to follow up with a physician. Okay, liver health. The liver is like the largest organ in the body. Here you can see it featured in orange. It sits on top of the stomach and all of the digestive organs. It is fascinating, actually. The number of functions that it performs for the body is stunning and quite miraculous. It filters the blood, so it takes harmful substances, it breaks them down so that they can be excreted into the bile and out of the blood. It works with digestion and fats. It helps to secrete bile to break down dietary fats so that energy can be produced from that. It helps to manage blood sugar levels from when we eat carbohydrates. It manages whether those extra sugars that we're consuming are stored in glycogen, like in our muscles or in the liver. And it can also break down stored glycogen to be used for energy in the cells if we're exerting a lot of energy, or even say in the case of diabetes, if that sugar is not actually going into the cells, it's going to start depleting glycogen stores from the liver and from the muscle tissues to help create energy so that the body can use. So it manages all of that, which is absolutely amazing. And then it does the same thing with proteins, right? If it breaks it down into amino acids, those amino acids can be stored for energy, or it can be stored as extra fat. So it kind of manages all of those and how those are stored and broken down in our body. Metabolism and detoxification. So the liver metabolizes and detoxifies us from different drugs and medications, even in excess of essential oils or herbs, proteins, fats, and carbohydrates, and helps to remove those toxins from the body. So by doing so, it can help to regulate blood sugar and cholesterol levels. So those are awesome. More roles of the liver. It makes proteins. So it makes proteins that are necessary for cellular structure and function. It makes clotting factors that help to prevent us from just bleeding out, so that our bodies, when we get a wound or a sore, we actually will clot and that will begin to heal. Then it also makes albumin, which manages the fluid balance in the bloodstream and in the surrounding tissues. If we have a low amount of albumin in our blood, our fluids are going to leak out into the tissues. Anyway, this is probably more information than you need to know. But anyway, it also produces, releases, and stores vitamins and minerals. Like the liver makes vitamin A for eye health. It makes vitamin B12 for cellular metabolism. And it makes vitamin D to help absorb calcium and the minerals that we need for bone health. And the vitamin K is the clotting factor that it produces to help with clotting, and also iron and copper. But all of these are necessary for healthy red blood cells, for healthy cellular function, for a healthy nervous system, for all of our genetic material, and so many things. There are a lot of things that can stress the liver: alcohol use, drug use, medications, NSAIDs, a lot more medications than just NSAIDs, infections like hepatitis C, a high sugar consumption, saturated fats. Maybe there's a blockage somehow in a bile duct, and that can block blood flow and oxygenation to the liver. And then if the blood flow itself also is blocked to the liver too. So a lot of different ways that the liver can become stressed, many things that we can manage on our own if we're mindful of those. There are several different liver function tests: AST, ALT, GGT, ALP. The nursing realm is consumed with acronyms. It's like you hear a new acronym and it's almost as if somebody made it up just to create another acronym. But all of these, I mean, a lot of these lab values have acronyms, and they do stand for things. Again, here you can see the liver resting over the top of the stomach and see how large it is compared to everything. Anyway, AST is aspartate aminotransferase, and this is actually usually stays within the liver. And when the liver is damaged, AST is released into the blood, and that is a marker, an indicator of stress to the liver. So you can see the normal lab values here. 8 to 33 is considered normal. Greater than 33 would be high. And if it's greater than 500, that would be severe liver damage or disease. ALT, very similar to the alanine is alanine transaminase, and does the same as the AST. It usually stays within the liver, but then it's released into the blood. These levels are different for male versus female. You've got 29 to 33 for male, and female are 19 to 25. And a lot of the labs are different, male versus female, the limits. So that is one thing to keep in mind is, are there female limits on this? Which one do I need to be looking at? And then again, higher levels also can indicate liver stress, damage, or disease. So GGT is an enzyme that's found in several different organs: the liver, the kidney, the pancreas, the heart, and the brain. A normal level is about 5 to 40 units per liter. And this can indicate several different things. It's not just specific to the liver. Like AST and ALT are more specific to the liver. This can be indicative of several different things going in the body. You've got damage to the liver, the bile ducts, can be an indicator of diabetes, heart failure, hyperthyroidism, or pancreatitis, or just a few that it could maybe be an indicator for. ALP is we call it ALK-Phos, or alkaline phosphatase. This is a protein that's found in the liver, bile ducts, and the bone. And the normal levels here are 44 to 147 international units per liter. And when you have high levels of this in the blood, it doesn't always mean that, oh my gosh, something's seriously wrong, but it could mean that you have a bone fracture that's been healing. And so it's producing some of those proteins into your bloodstream from the healing bone. Or if you have blood type O or B, maybe you just ate a fatty meal, and that could be an indicator of a higher ALP. But there are more serious things that it could indicate, maybe bone cancers, hyperthyroidism, hepatitis, lymphoma. But then again, if there are serious concerns, obviously you do want to consult with a physician. Low levels could be indicative of malnutrition, a protein deficiency, maybe your body isn't absorbing vitamin B12, which results in pernicious anemia, or even hypothyroidism. So those are some things just to kind of keep in mind, that these numbers, really reflect something that's going on physiologically in the body that could be an indication that we need to kind of monitor these things more closely and see maybe if some of these more serious things are going on, or, maybe it's just temporary stress, to the liver, and everything's going to be fine. So, love your liver. So there are some things that we can do to promote liver health, and that is healthy fats. So we've got your olive oil, your avocado, your omega-3s, lean proteins, antioxidants such as grapefruit and berries. Whatever's going to be healthy for your heart would most likely be healthy for your liver. LLV is, we love doTERRA. And the XCO omega, all of these are going to be helping your cells at a cellular level with the nutrition that they need, but then also your XCO and omega has your omega-3s that are super valuable for excellent fats for the liver. We're going to talk about inflammation, and this is taking longer than I thought. I'm sorry, Joel.
Stacey, can I pause you for just a second?
Yes.
Remember in the experience packet, if you got one of those in the mail, we sent a Z Omega with that. So you'll see those little red pills. Those are the omega oils that Stacey was talking from that last slide, the Z Omega or XC Omega, as you said. Yeah. I just wanted to let people know. So in your little experience packet. Yep.
Perfect. CRP, this is an inflammatory marker, and it's actually a protein that's made by the liver, and it's released to help the body heal from infection, injury, or disease. So, and these can be an acute inflammatory or infectious response from several things listed here, as well as maybe more of a chronic inflammation from an autoimmune disorder. So again, that's inflammation in the body. Again, it does help our body heal from infection, injury, disease, but we do want to keep those within a healthy limit. We want to keep those under control. HSCRP is one I've never worked with, but it is linked to more heart disease and can be an indicator of progressing heart disease. So CRP levels here, you can see normal levels are 0.3 milligrams per deciliter, and then a moderate increase would be 1 to 10, and a marked increase would be greater than 10. So, and then if you are interested in those for your heart, for risk of heart disease, that would be an HSCRP, which I don't think I've ever had done in any of my lab values, and I don't think we monitor that at the hospital where I work, but I don't know, something to keep in mind.
Can I hop in for just a second? Sorry, Stacey, is
Yeah.
that cool? Sorry, I don't mean to keep
No, you're good.
interrupting. But on so if you are thinking, hey, I have inflammation, I feel like I have inflammation, CRP is a great general marker to start with if you're going to take your own blood. CRP is something that's easy to do. You can include it in most of your blood panels, and it's a great start to say, okay, am I really dealing with inflammation in my body? And it can help give you that idea, or because it could be that you're dealing with water retention, right? Rather than inflammatory markers, you're dealing with too much water. So that can help you kind of differentiate that. So just wanted to hop in and give my 2 cents on that one.
That's great. Thank you. Hop in anytime. So we talk about the benefits of omega-3s and how important they are. They do act as an anti-inflammatory, and they can help decrease chronic inflammation, even like with autoimmune diseases and disorders like rheumatoid arthritis or psoriasis or type 1 diabetes or Crohn's. It can actually be very beneficial for those autoimmune diseases, but it can also help with heart health, and may decrease mortality from cardiovascular diseases. Like, it relaxes the smooth muscle of the blood vessels, it helps those be able to dilate, so that by dilating and relaxing those smooth muscles, it can actually lower the blood pressure if that person has high blood pressure. So that's something that can be very beneficial too. Omega-3s do a lot of great things besides helping with inflammation, supports brain and mental health, can prevent mental decline and Alzheimer's disease, and can also help reduce fat in the liver. So in the Lancet, which is a very famous medical journal, they said omega-3 fatty acids reduced cardiovascular mortality and improved cardiovascular outcomes. So I thought that was pretty important, that even, this is a noted outcome through studies that are done regarding cardiovascular health. And again, here's the picture of our LLV with our XC omega and also the alpha CRS, which does provide great cellular support. It reduces oxidative stress to the cells, helps with cellular energy production, healthy cell function. And it does even have the boswellia, which is actually frankincense, which also does help with inflammation levels. So it's another one to keep in mind. Just take all three. Lipid levels, we'll go through this. We've got HDL, LDL, total cholesterol, and triglycerides. So there are several different sources of cholesterol. Well, a couple in particular from the body. The liver does produce it. And that is actually necessary for the production of hormones and also for vitamin D. So cholesterol is a necessary constituent and component in the blood, but it does need to kind of maintain its proper balance. So it can also come from foods, different foods that we eat. It is necessary for healthy cell membrane structure and permeability. That lipid layer of the phospholipid layer of the cell membrane, and how different particles can be transported across the cell membrane. All of that permeability is regulated by that cholesterol levels in part. So that's an important thing to have for that. Again, produced in the liver and from the diet. Now we know our HDL as our good cholesterol and our LDL as our bad cholesterol. So the thing about HDL is it actually acts as a carrier for the bad cholesterol. And so you can kind of picture it as the little car that packs up the bad cholesterol or the LDL from the tissues and the arteries and returns it back to the liver where it's broken down and excreted or stored. Only 1/3 to 1/4 of the blood cholesterol is actually carried by HDL, but this does help to reduce the risk of atherosclerosis, which is the buildup of cholesterol in the arteries. And then thereby it reduces the risk of heart attack and stroke. So we want our HDL levels to be high. The higher, the better, pretty much. But even then, cholesterol is cholesterol, so not extremely high, but in a good, healthy high. So men will be 40 milligrams per deciliter and women at 50 or higher is the recommended range. LDL is the low density lipoprotein, and this is considered the bad cholesterol, and this contributes to the fatty buildup in the arteries that I just spoke about. So when those, you can see here how blood flows wonderfully through the top vessel, and the second one, it becomes a little bit more occluded, and then the third one, it can become completely closed off. That can cause a heart attack or stroke. It can cut off the blood supply and cause ischemia to the brain or the heart or, kidneys, to any organ at all. And it can also, particles of those, that plaque buildup can break off and cause problems as well. So we want our LDL to be low. So I kind of think HDL high, H for HDL, and LDL we want for low. So men, again, this is less than 40, and women is less than 50. And then our total cholesterol, that number is made up of your high cholesterol, your HDL, your LDL plus VLDL, which I'm not talking about. It's very low density lipoprotein, and it is a bad cholesterol, but that will give you your total cholesterol levels in your body. Triglyceride is another fat level that's taken into consideration with your lab values. And this is just the most common type of fat in the body. It's just what we store as excess energy from what we eat, right? And so if we regularly are eating more calories than we're burning, and especially if we're eating high carbohydrate foods, we probably have a high triglyceride level in our body. So normal level, we want that less than 150. Borderline is 150 to 299, and high would be 200 or greater. Very high, obviously, is something like 500. So hopefully we're not that high. But if you have a high level of triglycerides plus low healthy cholesterol plus high of your unhealthy cholesterol, you do have an increased risk of heart attack and stroke. So we do want to manage those levels and keep them within healthy ranges. Some ways to do this is to raise your HDL, because that's going to help control your LDL, right? So you want to do that with aerobic exercise, eating, maintaining a healthy weight. Mediterranean diet is one diet that's recommended, where you're eating lots of vegetables and fruits and healthy fats, mainly olive oil. Limiting alcohol intake, and then again, whoop, whoop, omega-3s and XCO omega. So we love this. So just to kind of summarize what we talked about tonight, for a healthy blood panel, we want a heart healthy diet as well. Anything that's going to be healthy for your heart will be healthy for the rest of your organs, for your kidney function, for your liver function, for all of your body function. Exercise, some aerobic exercise, regular exercise, to get the blood flowing and to help use the sugars so that, we can maintain that healthy level of blood sugars and maintain a healthy weight where we're not storing too many fats. The healthy fat consumption in your diets, getting those from healthy sources, and obviously supplementing with high quality products like doTERRA, with the XCO omega, the alpha CRS, the MetaPower Assist capsules that are going to help with our blood sugar control and our decreased fat deposits. So, I need that for sure. And then, all of your LLV is going to contribute to your cellular support, your antioxidant support, your healthy fats, and all the nutrients that your body needs to be healthy and within balance. So that's kind of my take-home message for all of us tonight is, a lot of just, wisdom in managing your health and wellness, and these beautiful supplements that we have from doTERRA to help us to be able to do that. So just want to turn it over to questions.